Okay, so right now we're going to talk about how the neutrophils actually infiltrate the inflamed area. Now, the neutrophils, first of all, you should know that the neutrophils are found within the blood in two groups. Now, they are either found circulating within the blood or adhered or attached to the blood vessel walls, especially in the lungs. Now, as we talked about in the previous video, when inflammation occurs in a tissue, it promotes vasodilation. So let us suppose that this is a vessel that is vasodilated, okay, in an inflamed area. Now, when the neutrophils are circulating within the blood vessel, they circulate and they actually are in the middle of the blood vessel. However, when vasodilation occurs, this slows the blood movement, and this creates some kind of turbulence, and this turbulence actually pushes the neutrophils away from the center of the blood vessel and into the margins of the blood vessel. So this process is called margination. Now, the next phase after margination is going to be rolling. And rolling is basically when the neutrophils actually roll alongside the blood vessel wall until they reach a point by which they can enter into the interstitium and into the inflamed area. Now, this happens when the neutrophils actually they upregulate some kind of protein, some kind of glycoprotein, and this is called a sialyl-Lewis X glycoprotein. Now, this sialyl-Lewis X will actually attach to some kind of protein that is called a selectin, and we have a P-selectin and an E-selectin. Selectins are basically proteins that are upregulated by the endothelial cells, and they help in the process of rolling because they attach the sialyl-Lewis X glycoprotein. Now, the P-selectin is actually upregulated by histamine, and it is made from the Weibel-Palade bodies that are found within the endothelial cells. However, the E-selectin is actually upregulated by the tumor necrosis factor and interleukin-1, which are both products of macrophage activation. Now, once the rolling occurs, we need to actually stabilize and adhere that leukocyte to the blood vessel. And this process would happen via the integrin pathway. Now, what are integrins? Integrins are some kind of proteins that are found on the surface of the neutrophil, and they bind to some things that are called cellular adhesion molecules. Okay, integrin cellular adhesion molecules. Now, these cellular adhesion molecules, the same as with E-selectin, they are also upregulated by TNF factors and by the interleukin-1. However, the integrins are upregulated by the leukotriene B4 and the C5a from the complement system. Okay, so this will actually adhere the neutrophil onto the blood vessel wall. Now, in some cases, we have a defect in the integrin, and this would cause something to be called a leukocyte adhesion deficiency. Now, this leukocyte adhesion deficiency is actually happens because the integrin, especially the CD18 part of the integrin protein, is actually defect or absent. Okay? And this is basically because of a genetic autosomally recessive defect. So when we don't have integrins, the leukocytes, they can't bind to the blood vessel wall, and when they can't bind, this will give us a variety of signs and symptoms. For example, we have inflammations and infections without pus formation. We have an increase in the neutrophil count within the blood because they can't adhere to the blood vessel wall. And the most prominent sign is going to be in infants is delayed umbilical cord separation. Now this occurs actually because when the child is born, the blood supply to the umbilical cord is basically cut off, and this creates some kind of necrotic tissue. And as we noticed, necrosis is followed by acute inflammation. To remove, in this case, separate the necrotic tissue or the necrotic debris. So when the neutrophils, they can't adhere into the blood vessel wall, so they can't pass on into the tissue and create the process of acute inflammation or phagocytose and continue the process of acute inflammation. So this results in the delayed separation of the umbilical cord. Okay? So the next step is going to be transmigration, by which the neutrophil actually transmigrates from between the endothelial cells and into the tissue. And then we have chemotaxis. Now chemotaxis is basically some kind of chemical attractants we've talked about and we've covered in the previous video. They actually attract the neutrophils towards the side of the inflammation, and these are leukotriene B4 and the C5a from the complement system, and interleukin 8 and the bacterial products. Okay? Now the next step is going to be phagocytosis. Now we're all familiar with the concept of phagocytosis. It actually creates a phagosome, and then it will create a phagolysosome. But first, we need to understand something. Now, this is the pathogen, and it has antigens on it. So the neutrophils are actually activated to phagocytosis because via two pathways. Either there is an IgG antibody on this pathogen, and this IgG binds to its receptor, and it creates the phagocytosis process. Okay? Or it could be the C3b molecule. And you should go and watch the video regarding the complement system. So the C3b molecule, the neutrophils also have a special receptor for the C3b molecule that actually also promotes the process of phagocytosis. We will continue in the next video.